Wound follow-up is a computer system to bring pictures of wounds in front of a skilled nurse who can share her knowledge and experience with the person caring for the wound. It's designed to be robust and secure. It's highly encrypted for security and easy to use. A visiting nurse or the patient himself can send in the pictures. The principle is to allow the skilled wound care nurse to share her knowledge with the person actually caring for the wound. The privacy and confidentiality of the pictures and notes is ensured by the careful design of layers of encryption and by limiting access to verified people. There's two sides to this: sending the pictures in and looking at them. Let's start with the wound care nurse looking at the pictures and talking on the phone with the carer. To start, the computer downloads all the pictures for her clinic. She presses Next and a patient with new pictures comes up. She can see thumbnails of the earlier pictures. Lots of space for notes. This is a picture from a few days earlier. Here it is in close-up. It's easy to send pictures by email to a consultant for another opinion. If the consultant uses wound follow-up, the pictures arrive like all his others. She clicks the photos to send and writes a few lines of chat, and it's off. We tested it in an old age home where pressure ulcers are a concern. She can mark the location of the wound and entered 3 scoring systems: Braden, Push 3 and the staging for pressure ulcers. This is the report. Now to the other side, sending in pictures. Take the picture with the camera you have. It's the conversation between the wound care nurse and the person caring for the patient that is important. Send in 2 or 3 if you like. Visiting nurses use this system to record the progress of their patients and to familiarize themselves with new ones. In between nursing visits, or when it starts to get sore or red, the patient can take a picture himself and send it in. The pictures are stored in the wound care nurse's computer. If the visiting nurse comes in to consult, she can upload her pictures and discuss a care plan with the wound care nurse. Email is widely understood. Send the picture to an email address comprising your phone number, very helpful for cell phones. Or you can upload from a web page. We can provide the code to put this functionality into your website. There is a wound follow-up app on the Android market integrated with this system. The app allows the patient or nurse to send in images along with a voice message. We tested the system with ostomy patients and in a nursing home. That's an ileostomy at the left with a bedsore on the heels below it. The ostomy patients liked when the nurse called. It's a big confidence builder to talk about this life-shattering change. Post-surgical patients or people with diabetic foot ulcers can send in pictures and get their wounds looked at. That's it. It's all about an easy way to get pictures of a wound in front of a skilled nurse and to get her recommendation and encouragement back to the person caring for the wound.